Introducing Pearl Fractional with YSGG, combining the benefits of CO2 and erbium in a new ablative wavelength. Video highlights include history of fractional lasers, YSGG's unique properties and mechanism of action, the Pearl Fractional treatment procedure, its clinical efficacy, and patient results. Designed to be superior to current ablative fractional products, Cutera introduces Pearl Fractional, its proprietary YSGG 2790 nanometer wavelength. Pearl Fractional aggressively treats the signs of photoaging, including a broad range of deep dermal imperfections in a single treatment, with only 5 to 7 days of downtime. Cutera's exclusive YSGG technology optimizes the ratio of ablation to coagulation. Early fractional lasers deposited heat deep in the dermis, but lacked the additional benefits of ablation. Consequently, 4 to 6 treatments were required. Current second-generation fractional lasers are ablative, removing tissue through a series of microcolumns. Some of these devices have certain coagulative properties, but until the introduction of YSGG, we have not seen the ideal balance of ablation and coagulation. Why is the wavelength critical when aggressively targeting the deep dermis? Wavelength enables control. The YSGG wavelength allows Pearl Fractional to maximize tissue removal through ablation, while simultaneously providing the benefits of a uniform, controlled zone of thermal coagulation and collagen stimulation. The cumulative effect of thousands of identical microcolumns being ablated across the skin optimizes patient results, treatment experience, and downtime. Let's discuss the ablation process. Ablation is the key differentiating factor between old, non-ablative technologies and today's fractional ablative devices. The laser heats the skin, vaporizing and removing columns of tissue. Simultaneously, it heats neighboring tissue, starting the coagulative process. Why does coagulation matter? If too little coagulation is present, as demonstrated with the erbium laser, the wound will bleed excessively, and the benefits of thermal stimulation are not realized. For this reason, Cutera chose YSGG, a wavelength with a uniform and controlled zone of thermal coagulation. Too much thermal coagulation, as can occur with CO2, creates a thick layer of necrotic tissue around each ablation zone, forcing the use of small spot sizes. To ablate the same amount of tissue as YSGG, CO2 would require more spots. Unfortunately, this would not be possible without an overlapping of necrotic zones and the elimination of healthy tissue, leading to longer recovery times and a higher risk of complications. The answer to excessive thermal injury is Pearl Fractional's controlled thermal zone. With Pearl Fractional, each treatment column stimulates the body through a unique combination of ablation and coagulation. Histology samples taken immediately after treatment and 4 days later show deep ablation and rapid reepithelialization, with a clear zone of thermal impact and collagen stimulation surrounding each treatment site. Over the next 3 to 6 months, the treatment continues to improve the skin through a long-term collagen stimulation phase. New collagen volumizes the skin from below, reducing or eliminating the signs of photoaging and deep dermal imperfections. The treatment effect, specific to YSGG, delivers clinical results with both operative ease and rapid recovery. Prior to treatment, topical anesthesia will be applied, and some physicians choose to augment topicals with other medications. A scanner controls the placement and density of 300-micron spots. Patients will reepithelialize during the first 2 to 4 days post-treatment, and erythema will gradually subside over 5 to 7 days. Following a single treatment, Most patients will see a marked improvement in photo damage and their overall complexion. Maximum results will appear gradually over a 6-month period.